And the last case I want to tell you about is a very exciting one because he was a triathlete. He was a Canadian triathlete who was teaching in Japan. And he developed pain in his hip. Came back here and he was found to have a huge sarcoma of the hip bone. Sarcoma of the hip, that's a very deadly tumor. And so he went to see a top surgeon and he said, we have to do an operation immediately. And what they would do was a hemipelvectomy. They take out half the pelvis. That means you'd lose a leg, lose probably the use of his bowel and bladder. He'd be a very sick guy after that. He said, no, I'm not going to do that. So he flew to Toronto to get a second opinion, and he spoke to the top surgeon in Canada. He said exactly the same thing. He said, no, I don't want that. He came back here and came to see me at that time. So I started him on some vitamins, the typical approach that I follow, which is lots of vitamin C plus some of the other vitamins plus diet. He also started himself on some herbs. Within 3 months, the pain was all gone. This is now 4 or 5 years ago. He went back to Japan, full-time work as a triathlete. He's just back in Canada now for the first time and is very active in Canada's health movement. The tumor is not gone. It's down to half its original size, but he's totally pain-free, and he can do anything. The tumor has been gradually receding over the years. Sarcoma. And that's the kind of stuff I see.